or something. Mm-mm. Okay. Okay. Let's see. I think you clean it all up. Yep. Okay. I think I want one. Mhm. Mhm. Hello.
Right? Once this landing page comes down, then John will put up the
Yep.
slide deck, right?
That's right. That's
Okay.
correct.
Correct, yep. Correct.
Okay, we have
Go on
people
mute.
coming in now as we speak.
Great.
Yep.
Great, great, excellent.
I did pull our wording if someone was to ask about potential merger. It was going to be short and sweet. If
Okay, good.
I was
If the
about to
question
ping
got
folks
thrown.
on Zoom, on Slack because I was worried that people might start. All right.
We have folks joining us now. We currently have 14 folks online, 15. We'll give everybody a minute or two before we start because we're adding people as we're speaking. So Cheryl and John, if you don't mind waiting for a minute or so, we'll let these folks sign on and we'll get started in just a few.
Absolutely.
And thanks to all of you who have just joined us. We look forward to our presentation today with Change Healthcare. We will be starting that in just a minute or so. All right, we have a momentary pause in folks pinging in. I'm sure we'll have a number more joining us. We have quite a few registrants today, so I expect we'll see at least 6 to 10 more before we get going at full throttle here. Good afternoon, everybody. My name is Denny Brennan. I'm the Executive Director of the Massachusetts Health Data Consortium, and I want to welcome you to the first of our webinar series for 2021. We are delighted to have our longstanding members, Change Healthcare, joining us today to discuss information security and the risk management associated with information security in the face of a crisis, especially as we know the COVID-19 crisis that appears to be abating somewhat across the country, but we're a long ways from the news getting better after it gets worse. So thank you for joining us. I understand that audio quality is poor. Arlene, am I coming clear through to you?
Yes, very clear. to
Okay,
me.
okay, good. We'll see. We'll make sure that we're speaking into our microphones. As you can see on the landing page, if you're interested in learning more about MHTC or about Change or about, what we're doing in the way of presentations, webinars, and what constitutes, the services we provide to our members and to the public, you can join us at any one of those links. Many of you know that over the 40 plus years that Massachusetts Health Data Consortium has been an ongoing concern, we have been actively involved in incubating a number of organizations or participating in the launch of a number of organizations that have had a significant impact on healthcare in the Commonwealth. One being the New England Healthcare Exchange Network, with whom we work closely and with whom we're planning to merge at the end of this quarter. Another is the Massachusetts eHealth Collaborative, which wound down its operations at the end of last year, is still an ongoing concern through the early part of this year. But the Mass eHealth Collaborative was led by a great friend, colleague, and collaborator, Mickey Tripathi, who many of you may know was named as the National Coordinator for Health Information Technology, which is freaking awesome, as they would say in one of the TV shows I'm watching. We're delighted. We congratulate Mickey. We think it's a fantastic choice. We were on the board. MHDC sat on the board of MAHEC since its inception. We chaired the MAHEC board for a number of years and worked closely with Mickey. So we're thrilled with that announcement. As I mentioned initially, we anticipate our webinar series in 2021 comprising upwards of 30 webinars, ranging in topics such as today's security and risk management, interoperability, regulatory change. There are 5 regulations coming down the pike or already down the pike that are going to have a dramatic impact on healthcare and health data. I won't go into those bear separate presentations on their own. So without further ado, I would like to introduce Cheryl Zarozny, the Consulting Practice Director from Change Healthcare, and John Zuziak, the Cyber Practice Director from Change Healthcare. And I will now turn the presentation, Cheryl and John, over to you.
Great, thank you. We are going to bring up the slides here, and I'll just talk for a minute while we do that. We're both really excited to be here today to discuss this very important topic, and one which we all know has been in the media quite a bit lately, as well as over the last year. We do want this session to be valuable, so we will have different points that we will try to stop, and Denny will help MC so that we can answer questions. We will also have time for Q&A at the end as well. So just wanted to kind of set the stage for that for you. So today's topic, information security, risk management in the face of a crisis. So I'm going to give you a little bit about my bio and then turn it over to John, and he'll introduce himself, and then we'll proceed. So real quick, as Denny mentioned, I'm the Consulting Practice Director for Change Healthcare. Have over 30 years experience in the healthcare industry, working at payers, providers, integrated delivery networks. I've spent about half my career, the first half working in those organizations, and about the last half or so in the consulting world with some different consulting firms. Actually have been involved with MHDC, I think probably since the 90s, back when I was at a payer, and had spoken to this audience on Y2K preparations as well as HIPAA back in the day. So that's a little bit about my background. I'll turn it over to John for his, and then we'll get started.
Great, thank you, Cheryl. So as far as my background goes, I've been within in healthcare information security for about 15 years. I started off with a large organization across the country, and I'll kind of tell some stories about my experiences there as we go through the presentation. But over 15 years of cybersecurity experience within healthcare. I've also, kind of the different roles that I've had. I was a chief information security officer, a director of risk management. So I've done a lot for this risk management space and within cybersecurity. Prior to that, I was within IT for financial side of the house. So kind of had a change of reality when I made the transition from financial to healthcare and some of what we see. But also, in addition to what I do within cybersecurity, I'm currently a member of the Department of Homeland Security and Health and Human Services Healthcare Security Coordinating Council. and a founding member of the Greater Cincinnati Health Information Security Roundtable, where we have a group of security professionals that get together every month and share some stories, help solve some problems. And then I'm also a strategic advisor for an organization, HealthGuard, and their governance risk compliance platform. Thank you.
Thanks, John. So I did want to just spend a couple minutes on the front end and just give a little overview of change. We have a lot of different folks on the phone, different levels and different roles in their organizations. And this is more so meant just to give context around the organization that John and I work for and how we fit in the healthcare ecosystem, just to give context of our background. So in terms of Change Healthcare, we've got a very large financial management platform. We've got three main divisions within Change Healthcare. We have our network solutions that some of you may be familiar with, i.e. clearinghouse data, software and analytics, which really is where we have a lot of our data scientists and how we bring analytics forward, both for our customers and within our products. And then the third area is what they call technology-enabled services, and that's the division that John and I roll up under in terms of consulting. Technology-enabled services does things like RCM management for hospitals and physicians. We have a consulting division. We have an accountable care group. So that's several areas that fall within technology-enabled services. I think the most striking thing for me, John and I are actually both relatively new to Change. The number of healthcare claims that come through our network and the dollars associated with that. So we've got about 1 in 3 patient records of every person in the US coming through our organization at this point in time. And then as you can see on the lower left, we work with about 6,000 hospitals, 1 million physicians, about 1,500 labs, 50,000 pharmacies, and 2,400 payer connections. And those numbers change. I'm sure if I got numbers today, they'd be even higher. So it's been a really exciting thing to watch in terms of how we are supporting the healthcare ecosystem across the United States. In terms of, what we've got driving our vision and strategy, our vision is inspiring a better healthcare system. So everything we do links back to that. And some of the areas and the key items are reducing the healthcare cost, building that connected healthcare ecosystem, hospitals, providers, payers, and really getting that all working together where we can gain efficiencies and lower the burden of the cost of the healthcare system, and then focusing on our outcomes. So that was really just to give you some overview. I think a few other comments I have before we move into the risk and security portion. Obviously, 2020 had many challenges for all of us. COVID pushed many companies to push their staff to a remote work from home environment, basically overnight. I know from the Change Healthcare perspective, in 9 days, we had 7,000 people pushed from home just within that short period of time. So that doesn't give you years to plan and policies and procedures to write and all these sorts of things. So we've all had to respond to that in our own way. This has also forced the expansion of digital business as companies had to make that move and shift people to a safer environment where possible to work from home. Now, obviously, frontline healthcare workers and our own employees who work within hospitals were deemed essential personnel, and they were continuing to work in the office, but we made adjustments, as I'm sure most companies did, to say what's essential, who has to be where, and can we have folks working from home. So definitely digital has increased in terms of removing paper, automating processes and things, and it really accelerated that across many industries where we all had to respond and sort of I've read studies that said that it accelerated that digital footprint by up to 5 years. So what it would have taken us 5 years to do on our normal pace, going through the process, really got accelerated overnight. And we've all had to work through that with little time to plan it, right? Because it came out of the blue. And then in terms of, just recent things, we've seen some unprecedented numbers of hospitals specifically recently put on notice to be careful, be aware. You know, I know of a hospital that pretty much had to go back to paper for a lot of their medical charts, and some of the patients had to come in with any information they had on their appointment because it basically totally shut down their EMR and their EHR. So unfortunately, we're a target, which right now in the middle of a pandemic is very unfortunate. But I think, you know, I think the topic is timely, and I'm hoping that you're really going to have some things today that you can take away from what John is planning to share with all of you. So thank you for your time, and we appreciate you attending today.
Awesome. And yes, once again, thank you everyone for attending. A couple things, it's been stated, but I'll go ahead and just reiterate, you know, at any point, if you have a question or if I start to go too fast, I tend to speed up as we go because I get real passionate about this and I just kind of get amped up. So if that should occur, feel free to reach out, slow me down. At any point, if you have a question, please make sure to ask that. I want this to be as valuable to you as possible. And so if, you know, we need to kind of tweak some things, happy to do that and have that conversation. Where
John,
I wanted to start.
John, it's Denny, just to add to that too, if folks want to put something in the chat box, we will be happy to do that, and please do that so that we can answer it. And yes, we will have slides available for the attendees after the presentation.
Absolutely, thank you. So where I wanted to start is the first few slides that we go through are going to be sort of academic and kind of just making sure that we all have a good understanding of some of the basics before we get into the what I like to call the fun part of the meat of the presentation. A lot of times I think it's important to start off with why. Why are we doing risk management? Why is that important? Especially when we have so many competing priorities within healthcare, and we have the competing priorities of the pandemic, the other threats that come from the pandemic. So with that, if you look up on the screen here, we have a couple of reasons why we complete the security assessment, more importantly, risk management. Like I said, the first few slides that we'll go through, really it covers the compliance aspect. And so we are required through regulation, through the Office of Civil Rights, and then later on a couple other regulatory groups, for us to conduct those security assessments and risk analysis. And so one piece that is required through the HIPAA security rule is that we are conducting an accurate and thorough assessment. That's pretty vague. There's a whole lot of stuff that we can do with that, so I'll dive into that a little bit more. But it's just making sure that we are going through that process. The other piece is when it comes to risk management, making sure that we're implementing security measures that are efficient to reduce risks and vulnerabilities. If for no other reason, the compliance aspect and the potential to reduce risk for our organization, cybersecurity risk for the organization, if that's not enough incentive, just the other day it was signed into law, and I'm probably going to screw up the regulation, so please go out and Google that. But it just came up, I think, on January 5th or 6th, that as part of sort of the safe harbor rules, if you can provide the information that you have strong security controls and that you are doing your best to mitigate risk, that can help to reduce and or get out of the fines and regulatory penalties that could come out of that. So just some another reason, kind of an incentive to have a solid risk management program. Another piece, another reason why we want to do that is through CMS, the promoting interoperability. We talk about how there must conduct and review a security risk analysis. So once again, we have to do that, and at least once each calendar year. I would make the comment that if we are only assessing once a calendar year, that's not nearly enough. That's great from an enterprise-wide assessment, but we need to make sure that we're actually looking deeper, digging into the organization from enterprise level, but then also down into the IT. Things change daily anymore. The thought that once a year is going to cover all of the changes that happen and mitigate that risk it's just not likely. So we need to make sure that we are conducting additional security assessments throughout the year. I like to do them whenever there is a significant change, and I would recommend that when you do that, it's not this huge massive lift of an assessment and risk analysis, but it's tailored to that particular change. So kind of you change your scope accordingly. Another piece here, another one of the requirements is, when we look at the risk assessment process, these are the 9 areas that we have to make sure are included in our assessment. We'll get into that. I'll hit some of the processes that I like to go through that will help the organization meet and match that. But overall, these are just good, solid kind of best practices, if nothing else, of how to conduct a security and risk assessment. Here we also see that, according to the OCR, that we are supposed to, go through the risk analysis process, that it should be ongoing. So it's kind of two regulations, a little contradictory, but the key is making sure you're conducting those assessments. Ideally, like I mentioned before, we want it to be continuous. Whenever there's change, we assess that and look for any new risk to the organization. And that it's truly integrated with risk analysis and management process is performed with the business operations and then any new technologies. And then here, if it's determined that existing security measures are not sufficient, that we're putting in the right controls to protect that information, and then the entity must determine if additional measures are needed. So once again, looking at it holistically, making sure that we understand what's the impact to the company. So kind of more of the same. So I'll kind of gloss over that. We'll go to get a little bit more exciting stuff here. So when we look at really what is risk management, what is security, information security, what is risk? It's critical that we look at it from a few different angles. The first is, there are truly three components that make up risk and what we need to be making sure that we're analyzing as we go through that assessment process. The first piece over here is the threat. In order for there to be risk, once again, these three pieces will make up risk, but in order for there to be risk, there has to be some form of threat. In cybersecurity, we're looking at things such as the malware, phishing, ransomware, but really, that can be anything about your life. Day to day, we are all managing risk, whether we think about it or not. Kind of the easy analogy there is, with a car, as we're driving, every day we take on risk through driving that car. The threat could be one of our police officers checking the compliance of us, and are we speeding or not? So that's critical. So it's something to keep in mind there. Another way to tie it home. But once again, back to the cybersecurity piece, when we look at risk, we need to make sure that we understand the threat itself, the asset, whether that's a laptop, a server, the database, that we understand what could be under attack. And from an assessments perspective, that is part of the scope of what we're looking at. And then the last piece here is the vulnerability. We need to make sure that as we do that assessment, we're looking for what vulnerabilities exist in the environment, control gaps, such as a legacy operating system, the lack of patching, missing antivirus protection or encryption, something along those lines. That will create that vulnerability. And then when all three of these line up, right, we get that beautiful sweet spot of the risk to the organization. And that's really what we're driving to understand. So another key piece here is making sure that we understand when we look at security, that can have kind of a broad-ranging definition to it. So we want to look at it from making sure that we truly understand what we are trying to secure. What's the point of this? We don't want it just to be that a checkbox exercise that we go through and that assessment sits up on the shelf. We want to make sure that it's meaningful to the organization. So we look at it from there's three core components to make up security or information security. The first is confidentiality, and that's protecting the information from being accessed by an unauthorized third party. Really, if you think about it, that's the HIPAA security rule, right? That's the big component of that. What we've seen traditionally has sort of been the big stick behind it. Whenever there's a breach, it's trying. The rule itself is trying to define, was the information accessed by an unauthorized third party. But another core component to that is the integrity of the data. We want to make sure that the data is not altered while it's stored within our possession while we're managing it. We want to make sure, especially in healthcare, I think this is critical. Not that on the financial side, if our money changes, within banking, that's definitely a problem. Let's add a zero to it. But we want to make sure that that in healthcare, the integrity of the data is kept intact. One of the worst things that I could think of is if an organization is breached and the integrity of the data changes. So a particular diagnosis has changed, or within an imaging system, the image is changed and a mask is added to that, or removed, right? Both of those could change the way that treatment is managed. That's the last thing we want to see happen. I mean, that has a real patient safety implication, and we want to make sure that we are preventing that from occurring. And then the last piece of the security triad is availability. We want to make sure that the data is available to those users that have a need to see it, and they can access it as needed. That's critical within, I will say, healthcare as well. We see this all the time with ransomware, right? I think there's a news story every day about this latest ransomware attack that's taken out a hospital's EMR, and they're unable to treat patients. They go on diversion. So there's the loss of money with that. But more importantly, I think bigger than the financial aspect is those patients are being delayed in getting the help that they need. If they're coming in through the ER, if they're on the floor being treated, that's just delaying their treatment that much more. And it's one less piece of information we have to treat them. This past year, 2020, as though it wasn't crazy enough, we had our first direct result of patient harm when it came from ransomware and the availability of data. If you weren't aware, there was a patient that was in transport to the hospital, just having some type of event. And as she was being transported, they realized the hospital was in diversion, so they had to go to another hospital, a little more than 25 minutes away from the closest one to her. And unfortunately, she had passed during that process. So that time window had a real direct patient harm. So if for nothing else, we had the compliance aspect. We don't want to be in trouble from the regulators. We have the financial aspect. We want to make sure we're making our organization as much money. But we also have that patient safety, the critical kind of moral ethics behind why we want to secure this information. So this is a bit of an eye chart. I hope you can see it clearly up on the screen. I will walk through each of these pieces of it, and this will be the core piece of the presentation. But this is, to me, critical process, the process of how we secure or how we manage risk within our environment. This is definitely specific to cybersecurity. So this is one thing that you want to make sure you're doing for the cybersecurity component. But I will say this is a great framework, a great process for the entire enterprise risk organization. So I'm a firm believer, and many of my colleagues are firm believers, that we do not treat or we do not believe that risk is owned by, or cybersecurity risk is owned by just the IT department or the security department. It really is a business issue, and it's something that needs to be owned by the entire organization. So the first piece, well, let me say there are 4 processes to risk management in my book. We have the discovery. We need to understand our environment and pull that information together. The second is analyze. We want to make sure that once we have all of that information, we are truly layering all of that and doing some type of analytical review of it to understand what is the impact to us, what is the true risk to the organization. The third piece of that is treat. We want to make sure we're treating that risk and then monitor. Now, one reason why I'll kind of lead off with an important reason why I think this is such a good process and a framework to manage risk is, should there be an event within your organization and you report that out, you have a major breach, you report it out to OCR, you go through that process, and you're going to get a letter, kind of the investigation of what happened. We want to understand what occurred. We want to make sure that that you had the right controls in place, that you were managing the risk as per the rule. And so this does provide that information, so that evidence that you can easily hand over to any regulators to show, we were doing our due diligence. Unfortunately, we live in a world, an environment where breaches are going to occur. It happens far too often, even to some of the most secure organizations. FireEye, if you're not aware, is one of those top security firms that exists out there. Many of us are customers of that organization, and they do a phenomenal job. Unfortunately, they were breached, and they were breached not for negligence or lack of security controls, but because they were targeted, and it's going to happen. So we have to focus on preventing it, but we have to know that when it does occur, we need to detect the event and contain it, recover from it, but then also be able to speak to what happened and how do we improve from here. And this is just that process to get it done. So back over on the discovery piece, if you're able to see there, here are some of the core areas that we need to make sure we are collecting, data that we're collecting from it. So the threat data. This is critical to that. I mentioned back when we talk about risk, we have to have those 3 aspects, the threat, the asset, and the vulnerability. The threat data is kind of a couple things. One, we need to be constantly modeling threats within our organization. What's going to be impactful to us? What are we a target for? And we can do that a couple of different ways. One, if you look at your security tools, I believe these days all of us have a whole host of security tools that we have at our disposal, and all of those are logging information that we can collect on. So we need to see what threats are we seeing? So a perfect example of that is, at your firewall, you're probably seeing scans daily coming from different locations. Being able to pull that information down and look at that, collect that, and understand how many times are we being scanned, where are we being scanned from. That will help you understand what threats that you have specific to your organization today. But the other piece is within the industry. Right? All the industries have different groups that will help provide that information. For those of us in healthcare, the Cyber Health Working Group, which is a division of InfraGard, does a great job of providing some of that threat intelligence. Another thing is MITRE. If you're not familiar with them, they do a fantastic, it's a great framework to understand different actually attacks that are taking place and being able to help you model that. So understanding, what type of threat could occur and what's that chain look like to identify that to specific to my organization. And the other piece is you can pay for services that will provide a whole host of threat data. Sometimes it's a bit overwhelming, but it's a great information, it's a great data point in order to help build out your risk management process. So then we also have, the asset data. This right here is critical. Excuse me, and a lot of times it's very difficult to find. It's truly amazing how in healthcare, I've noticed when I was within the financial industry, I think there was pretty much everywhere you turn, you had a whole list of assets. I mean, it was just, you could not get away from the asset management, the tags around the computers. When I moved into healthcare, it wasn't quite as ironed out. There were a lot of gaps when it came to asset management, not in the sense that we didn't have the tags we need to do an inventory, but just the maintenance and the routine of that. So, I do have a spreadsheet that I'll show you at the end. A lot of times when we're being assessed, the question is, do we have solid asset management processes? And that's great. That's great from a maturity perspective to understand that. But I like to kind of keep things simple if I can, especially if we don't have the funding and the resources to, implement this huge program. I'm going to skip forward real quick. I'll kind of speak to this when it comes to data collection. So pardon me for any, if I make you nauseous as I go through here. But so this is just an example, very simple, high level, view of how we can manage and track some of the assets that we have in the organization. This is just a list of the IT applications. And what we do a lot of times is I'll look for, ask the company, IT department, if you can, pull the list of IT assets in the sense of the laptops and desktops that you have. Pull me the basics from that. What do we have today? If there isn't, a true asset management program in place. And we'll pull that list down, organize it very similar. We'll have the hardware listed here, databases and servers as well. And then list, does that machine, is it involved with some type of confidential data, regulatory, PHI, PII if needed. And, we'll just kind of do a checklist of, what controls we have in place. Then we'll do another similar one for the applications themselves. What applications do we have? Are they used to store, access, transmit data? Was there a prior assessment? What controls do we have in place? Some of these high-level controls. And so as you can see, this isn't anything that we're necessarily spending countless hours on, in managing it, but it will give us a great snapshot. So I will say this is sort of that level one, step one of the maturity, right? We want to get something basic down. So then when we go back to our asset process over here, asset collection, now we have some information there. So now we can really focus on what assets are important to our organization. What do we want to control? And why that's important. Yep.
It's Denny Brennan. I just wanted to ask a quick question. When you had your asset spreadsheet up there, one of the applications was SolarWinds, which is at the center of this enormous hack that has affected government agencies, corporations. Not to take you off track and derail your narrative, but at some point, I'd be really interested in hearing your perspective about how a threat of that nature it requires, a different type of vigilance or a different type, how that's what we've learned from that will help healthcare organizations, be better at managing risk going forward, because this was under the covers. This was done by tools that are used to manage networks all over the world, and it was kind of getting into the nervous system of a lot of organizations. So it'd be interesting to hear your perspective on that. Thank you.
Yeah, absolutely. And I think this is, I'll kind of describe it one way. So when I started in information security, we had this philosophy, what I like to call it now, I kind of jokingly call it the M&M philosophy. So we wanted to make sure we had this hard, crunchy exterior, this big shell to protect our network. But then once you're inside, it was real soft and gooey, right? There were very little controls. You didn't treat everything as secure. That I think is, I would say that philosophy has to change. We're now in this realm where now that we're seeing the supply chain be attacked, and we're seeing vendors, some of us within healthcare, we see some of the business associates be attacked. Even if they have, once again, phenomenal security controls in place, it could happen. So we need to make sure that within, we have that zero trust philosophy. So within the environment, we still have a whole set of controls in place. And some of that is easy to do. Some of that's a little bit more difficult. And I'll even say easy to do sometimes it's much easier to implement the control than what it is to sell it to the end users. Perfect example, this is kind of one of the areas where I skinned my knees on a little bit. We were starting to dip our toe into the zero trust and making sure that we had multi-factor authentication, not only while you were outside of our network when I was with one of the hospitals, but also inside the network. So we built this model where if you were on our network, you're going from floor to floor, going from machine to machine, and you were signing in, that you had to have some other form of multi-factor authentication. Great idea from a security perspective. It was phenomenal. I learned very quickly. Horrible idea from a clinical and workflow perspective. So we had to kind of readjust and find that balance and find really compensating controls. So that helped us we kept that in place until we could segment the network, keep some of the IT assets on a different segment, make sure that we had monitoring, sort of the east-west monitoring within the environment. So if there's some type of bad activity going on, we could catch that, and then we could sort of reduce those controls internal. But the whole point of this was we wanted to make sure that we weren't just assuming if you're on our network or in the environment that you were secure. We wanted every step of the way you had to verify yourself, kind of trust but verify. But I will say, kind of to your point, it's so unfortunate that it occurred, but it's probably realistically it was a long time coming. With SolarWinds, I think there's a handful of lawsuits and articles that I read of some of the mistakes that they made or issues that occurred there. But I will say they're not alone. Vendors, it's going to happen within the environment. Unfortunately, when you have these well-funded threat actors that are out there, such as the large crime rings, or really where a lot of this is being driven from today are the nation states. So you have nations, Russia, China, North Korea, Iran, who are using this information to, one, create some distrust within our environment, but then two, fund their countries, really, some of their programs. It was a few years ago, we had a ransomware attack that came across. You could really almost watch it, flow across the world, across the globe. That it was kicked off through North Korea. It was ransomware, really hit the healthcare organization. We could see machines going down, being encrypted along the way. And that was really all an attempt to get funding for North Korea's, I believe, kind of to be their nuclear program, but just within that country. So it was kind of a new revenue stream, unfortunately, for some of these countries. Side note on that, I could be a storyteller on some of this stuff, but where I was at the time, I was with an organization that we had hospitals east to west coast. We heard about this occurring. Probably had to be a Friday night because I think that's when all the massive attacks occurs for some reason. But we immediately, we heard about it. We could see some of the activity occurring through the threat data that we were receiving on, across in Europe. So as we were watching, we were following it, and you could really visualize it occurring, kind of going from country to country, east to west, or I guess west to east, east to west. Not the best geography. I'm a security guy. But you can see it, flowing through. So we were constantly on calls that night, making sure that, we had controls in place, realizing that, through our risk management activity, we knew where we had some gaps, and we needed to make sure that we were protecting those. So we put in some immediate controls, but then we also started to communicate to our teams what we were seeing from, from overseas. Well, that whole activity occurred over the weekend. I can remember being on the call pretty much all day on that Saturday, and we were on different organizations, hearing different threat data that was coming through. We were meeting with a lot of our vendors to make sure that our security controls were up to date, that they had the latest patches. And we did have one fantastic security control. I don't want to name drop yet, but if anyone asks me, I'll make sure to drop the name. But it was one of the controls that we had in place, picked it up right away. Once we started to see it, they grabbed it, they alerted us, and they were able to shut it down. So that particular vendor was able, as it was flowing across the world, they saw the pattern and they started to put stops in place for it. So great thing there.
John?
But I think, yep.
Sorry, I just wanted to say, because we have all different types of roles on this call.
Yeah.
Can you explain briefly the difference between when you get attacked because they're trying to steal patient data, social security numbers, banking information, versus a ransomware, just so that there's an appreciation? Some folks I'm sure know, but in case anyone doesn't,
Yep.
The difference between the two and what they're trying to accomplish.
Absolutely. Yeah. So what we're seeing these days, what comes to a lot of this threat information, there are different groups have a particular reason that they're going after. The financial aspect is definitely the largest reason why these cyber attacks are occurring today. We still get some what I call like hacktivists that are looking really just to kind of cause a disruption and get their point across. But really, it's the financial aspect that's driving the majority of these attacks today. So you do have the case where an attacker will get on your network and copy data and exfiltrate that to their organization. Unfortunately, they are that sophisticated and structured these days. They'll take to their organization in order to sell that data out on the dark web. So that's one way that it occurs. Now, when you look at ransomware, that's a little bit different aspect. So what they're doing is they're taking a piece of malware, which is just malicious code, and they're distributing that out into the environment. What they're doing with that is once that malware has infected your machine and it's in your environment, then they'll send what's called a payload to it, or it could already be carrying a payload. And just think of that as, that's sort of the attack vector of it. That's what they're going to do. That's the information to go out and do it. And a lot of the software will call home, and so it can be a timing thing. They might infect your environment. It'll dial home and say, we're embedded here, and then they'll wait 3-6 months later. Then they'll hit the button, and then this attack will occur in your environment where, for ransomware, it will encrypt a machine and then look for other ways to encrypt other machines. Sometimes it'll do that just by looking for particular files. So it's looking for something that, a database file, or it's looking for, different vulnerabilities on a machine, just in any effort to spread itself through that environment. So once it does that, once it encrypts that machine, then you'll get a little pop-up on your window that says, we've locked your machine, it's been encrypted. If you'd like to have the information back, feel free to send us, X amount of dollars in Bitcoin. The first time I was involved in a ransomware attack was back in probably 2011, somewhere around there. And it was a small physician's clinic, had probably 10 to 15 machines within that environment, and a big EMR. And what happened is once it was encrypted, they got the message and it was asking for, I think it was like $500 at the time, something like that. It was less than $1,000. The team within the practice just went ahead and were like, we can expense that. Bought the Bitcoin, sent it over, submitted the expense report for it. And unfortunately, not all thieves have honor, or there's not always honor among thieves. And they did not, that group particularly sent it over the decryption key and they got their data back. But another time, they didn't. Unfortunately, where we are today is because people were paying that ransom, we've seen a spike in the value of it, unfortunately. So on the market, when now when there's a ransomware event, you're looking at the ransom itself to get your data back is somewhere in the neighborhood of $1 million. It's increased that dramatically over the years. So it's now there's also some laws on being considered of, is it impossible or will there be a fine if you pay the ransom? in order to help drive that number back down. You're kind of caught, at that point. So, Joe, did that help kind of explain the difference there? Okay, I take silence. So going back over to, to our process, the discovery piece, this area right here, we got the controls. And the control itself is what we're looking for to make sure that, we have the right protections in place for a machine. A lot of times when we look at our regulations, these are the things that are required. So are we encrypting data at rest, confidential data while it's at rest? Are we encrypting that data while it's in transit going across the public internet? Do we have antivirus? Do we have strong access controls or passwords for a particular application? Do the applications of the network require multi-factor authentication? And that's, those are the controls that we're looking for. And then we have the impact. And this is another area within healthcare that seems very difficult to pull together a lot of times, because it really does require a lot of conversations. But this is, if you're familiar with business continuity or disaster recovery, this is, to me, is really the impact analysis. So it's where you're going out and having real conversations with the business folks to understand, if this application goes down, that's looking at from that availability aspect. If it should go down, what's the impact? What is the patient impact? What is the member impact? What is the financial impact? And then we can use that information to build that impact analysis from there. One of the best things that you can get out of this when you go through this impact analysis is, especially if you're coming from the security side or IT side, a lot of times we tend to think in bits and bytes, and we don't necessarily fully understand the business and a lot of the processes that go on within departments. This will help you dramatically. This will really provide that information so you know what's taking place in the organization, what's meaningful in the organization, how do departments work, and you build relationships. So I would say, if of this discovery piece, this might be the most time-consuming, but it's also the most valuable for anyone who's participating. So once you've collected this information, it's critical that we do that analysis, that we understand, really taking that holistic view of these 4 buckets. What does that look? What does that look like? And there's a couple ways you can do that. We see a lot of times the traditional method has been you have this matrix of what's the impact and what's the probability, and it ends up kind of, you do thumb in the wind, grab a piece of grass and throw it up. You say, well, it's the high probability and it's a low impact, so it's a medium risk. And that's good in the sense that it gives you something to go off of. It's good information. But I would argue that other than really defining sort of a priority, that's sort of that sniff test or just kind of a low level risk analysis, that's not really where you want to be. To me, that's sort of that maturity level 1. The next piece, and the next kind of part of analysis that occurs is what they call semi-quantitative. And that's where they are grabbing of that matrix, rather than use high, medium, and low, or red, green, yellow, we use 1, 2, 3, and 4, 5, 6, numbers like that. Then we try to multiply those numbers and say, well, this server doesn't have antivirus software on it, so it's a 7. But unfortunately, the problem with that is you don't get the context. So if you take that risk analysis and you go to your whether it's a compliance committee or leadership meeting, or you fire off an email on why we need to spend this money, justify why we need to add this control, and you say, well, it's a 7. That sounds good for us. Those who are kind of deep in the weeds and running it might feel good about that, but there's no business context to it. No one really understands what's that truly mean and how does that impact the organization. So here's where I'll throw out the next piece is the next level of maturity when it comes to risk management or risk analysis is quantitative. And this is where we're truly estimating using proven methods and ways of coming up with these numbers. We're using probability factors to understand what's the probability of an event occurring. But then we're also looking at from the impact. We have real numbers because we've collected that from this impact analysis over here. So we have real numbers that we're working with to know and say, if the system goes down and it's down for 2 days, it's X amount of dollars that are impacting that department, that business unit, or the organization. And we can really start to justify why we need to put these controls in place. Or, more importantly, argue why we don't need to have a control in place. So that's just something to think about. One group that's really big in this, and an area you can probably dig up some more information on it, it's called Open Fair. And they have a whole set of processes out there that you can follow when it comes to that analysis. And I'd be happy to share more information later as well. But as you go through here, one thing you'll notice is as we start to dive into that information, that we need more data, right? We collected all of this. We started digging into it. We created maybe a scenario, ransomware, of what's that look like to our environment and these particular assets. But we got to go back and get some more information. So we did a little bit more discovery. We also have to document what are our assumptions. What are we assuming is going to occur, and what do we not know could occur? So kind of document some of those potentially known unknowns or unknown unknowns, and put that information down on paper as well. But once we have all that, once we've identified what the gaps are, we've put an impact to it, we have a number associated with that, we need to report out on it and give that over to what I'll call the decision makers to help decide where we need to go from here. So a couple of the things that we're going to use to make that decision, we have the cost-benefit analysis. I mentioned before that we might have a control gap that it's extremely expensive to fix. $100,000 to put new antivirus software in across the board, or antivirus software in, and maybe for whatever reason we determine that the impact of that is minor. It isn't, but maybe it's minor. It's just not worth putting in. We need to make sure we pull that information out and we have that set up. The other piece is when we have to look at competing priorities. All of us as companies, all the organizations we have, or at least I should say, if you're anything like me, you're in an organization where there's a lot of stuff going on. You're very busy. So we need to make sure that we understand what are those priorities and where should things fit in the line of getting things done. Third is the risk appetite for the organization. Maybe different departments have different check signing authority. Maybe we get this sophisticated enough that each of those departments also have a risk acceptance. Or we know that as far as risk goes within the organization, if it's less than $50,000 or $10,000, we just don't even care about it. It's just not even worth discussing. So just let that go. Let's focus on the bigger things. That's the company's risk appetite. And then it's also the culture and politics and some of the cognitive biases that we may have. That will flood into how do we make a decision. This is the area, once again, I mentioned early on that I'm a firm believer that the risk isn't owned by IT or security. It's a company decision. So we need to have different players involved in helping to make those decisions, or at least be aware of the decision that we're being made and accountable to that. So this is the area where we also create our, the risk treatment plan, so we understand what is our kind of corrective action plan in order to mitigate this threat. And with that action plan, it's key that we're documenting it. So this is kind of where I'll say risk management turns into a little bit of project management. That if we've identified we're going to implement a particular control, we're going to, lock down USB drives across the board. We know that is not something that we can just do overnight. So we have to phase that in, and we need to make sure that we've documented our action plan. We've assigned who is the owner of that, who's responsible for getting that done, and what's the time frame that they're going to do that. And then if anything should occur along the way where that plan shifts, the timing is extended, we need additional funding, we need additional players involved in that, some additional resources, that we've updated that plan, that action plan within I would call it a system or an Excel document, something like that. So we have really a paper trail of what occurred. And we can continue to monitor and make sure that that is being mitigated as we've agreed to as a team that we're going to mitigate that risk. And then last, we need to make sure that we're monitoring. And to me, this is extremely important in the sense that if the company has given us money to mitigate a threat, and we put in this control, so we put in an antivirus control in place, and we just sort of set it and forget it, do the whole Ron Ronco treatment of it, set it and forget it, and we walk on. We have no idea of knowing if we've spent that money wisely. So we need to make sure that we're monitoring and making sure that that risk is truly mitigated, that the control is effective and efficient, and doing the right thing for the organization. And then I'll say the key piece to that is, so we're validating it, we're understanding the key risk indications of it, and then it all goes back over to discovery again. We start the process all over. And this is I'll say this whole level should be the risk management program for the organization. But we also have to keep in mind, as I mentioned before, it's a continuous ongoing effort. We might, annually do something like this, but as we're signing contracts with new vendors, maybe we take out some of these pieces because they're just, it's a little bit too administrative of a burden for the organization. It's too bulky, or we know that the assets are limited, the control from the vendor is limited. So we look at that a little bit differently and scale it down, but still kind of follow, making sure that we're still accountable to the same process and documenting. I will say one piece is that why this is so important, a couple of the reasons why it's so important to have a formal risk management process where we can actually document and provide that information out to folks is one, should there be a breach, I mentioned earlier on that you're going to get the letter from OCR as part of the investigation to provide, what was your last risk analysis, risk assessment analysis, and your corrective action plans. When that comes in, you want to be in a position to share that information right away. You don't want to have to circle around or take a lot of time at that point to add or create different things. You want to make sure that you're getting that information out, as fast as possible, and that you're not just, creating things on the fly and getting out just so it looks good. And this will help keep you true to that. The second piece is this will help to justify the security team's existence. And what I say that when I started as a chief information security officer, it was with an organization that was separating from a national, large national health system. We had 12 months to get off of their entire platform, all of their IT assets, 12 months to get off of that. And I was sitting in a position thinking, one, what's my budget? I didn't want to just go out to, our leadership and say, I need X amount of dollars to do stuff. I wanted to make sure I truly had that built into a plan and a roadmap. So the first step I took was risk management. I went through, stood up a risk management platform, very simple process there with what we did, but we stood that up. And then we went through this and we were able to take this information and tie that to each of the controls that we wanted to purchase. So we could actually go, the leadership team could see what really they were paying for. And that helped on so many different levels to justify our existence. But then also when we were told we have to cut spending by 10% the following year, we were able to say, well, this is the risk that we're bringing, that if we cut, this is the risk that's associated to it. And that really helped to shed light on it. So we were making at that point business decisions, not IT or technical decisions.
John, that brings up a good point. Obviously, a lot of this is focused, and people may say, and I think you said it earlier, this is all technology based. This is a technology risk assessment that has to tie into the business in terms of solving the larger issues, because as most studies have shown, most of the risks get introduced through accidentally, through a phishing email or whatever. Do you have any examples? I was trying to think of them for myself too, but where you've seen the integration work well between the technology risk assessment and the business risk assessment, maybe where you've seen things work well or where you've seen things not work well, and why that might help some of the folks here understand kind of what to look for as they support a risk assessment moving forward.
Yes, yeah. So we were, both the healthcare organizations I was with prior to Change, we were, I would almost say, embedded with our enterprise risk team. We were separate. We're part of the security group, but we would feed information to them monthly. It felt like daily, but I realized it was probably monthly. And then we met with them and the leaders quarterly. So we were able to kind of almost have a carve out of here's what the cybersecurity risk is to the organization, along with all of the other enterprise risks that were identified. And that's things as, patient safety, what's the risk of, falls within the organization. So we had all of that. And the company, the leadership team could then help to prioritize where does security fit in with the rest of the company risks, right? And it made for great conversations on a couple different reasons. One, leaders could now really see what cybersecurity risk was, what they were faced with. But then also it was humbling for me. I came from that IT background up until that point. And of course, I always believe that security is the most important thing. We need to make sure that we're secure, we're closing all risks. But what I could see is, no, really in healthcare, we're different, right? I mean, it truly is a balance. And so we could easily see that if, we have patients who are falling in the hospital, we definitely need to invest in stopping that from occurring, not ignoring these other pieces, but just really seeing where they fit within the organization. That was huge for me. So Charlotte, hopefully that answered that question, what we could do. But I think the key is communicating that risk up, kind of when we make those decisions, and personally when we have when we're doing this, there should be a committee. We should have either as a security steering committee, risk committee, or even tied into the enterprise risk team where we're feeding that information to help make those decisions.
Hey, John, I have another question.
Yeah.
Several things are happening right now that are probably driving chief information security officers out of their minds. One is that the whole notion of data sharing across enterprises and to ultimately the consumer, which is at the heart of the CMS proposed interoperability and information blocking rules. That suddenly opens up a pipe into patient data that didn't exist before. And now we also have proposed changes to HIPAA itself to account for, HIPAA was written before there were electronic medical records and before there were people having their personal health information on a digital device. That's changed the landscape. You have to be able to share, but you have to be secure at the same time. Could you comment a little bit about that?
Yes. So I think the first thing to remember with this is this isn't our data per se, right? We are really custodians of the data for the patient or member. This is their health information. That was one thing that I learned early on within healthcare through my privacy officer. She lectured me on it a few times, and it started to sink in that really that's the goal, is that we are, while we're in sort of custody or the custodian of that information, we're securing it in the sense that we want to make sure it's available for the patient and the member when they need it, but then also that it is the integrity is in check and that it's kept confidential. So that's a key piece to it. But and kind of an example of that is when we were in the hospital, we had a lot of need to give information to our patients, and they wanted the images, right? I used to be able to get the kind of print it out. You could have that, take it to your next specialist, they could see it. But then it became, we had to burn it to CD, which was fine within the hospital. Most of the time, IT and security, we knew it was occurring, but we didn't really know how often or where it was until we started to block USB controls. We wanted to make sure that, anytime that a USB drive was going in, it wasn't exfiltrating data. So we put in this great control across the board, but what we didn't realize is within our the radiology department, they were saving the images to the USB drives to hand to patients as they requested to take to their specialist. And so what happened is we broke that process. And we were, from a security side, we were still saying, hey, no, that's the rule. You can't do it. We're protecting our data. That was the term that we used, our data. Once again, that was when I learned from my privacy officer that it's not our data. This is, according to HIPAA, the patient has to be the right to take their data, portability, and go to anyone else. So we have to be able to provide that to them in whatever means that they want it, right? That we can provide it, but they need, however they want it, we have to give it to them, whatever the risk is. So I think why this is so important when we look at this process is this helps us understand what controls we have in place, where it is. So when we do have these changes, this digital transformation that where we're now sending out all kinds of patient data for good reason, out to as part of the healthcare process, we know where it's going, how secure it is as it leaves our door, and we have evidence of that occurring. Right? Once it's within the other third party or within the patient's hands, that's for them to secure at that point. That ends our sort of reign of being the custodian responsible for securing it, and we've turned it over to somebody else. So hopefully that helped to answer that question. Yep. All right, so I keep mentioning controls and dropping the word control left and right. And I think it's important to understand, when we look at security and the remediation and implementing controls, what is that magic bullet? So up here on the screen, I'll say this is the magic bullet. This is what we need to do to make sure that we have completely secured the environment, we've protected the data the best that we can, and we're able to respond should an event occur. Unfortunately, us in healthcare, it's not really reasonable in a lot of cases. I mean, maybe if we're one of the massive companies that can do all of this stuff, that happens. But if small healthcare organizations, single clinic or provider, small payer, security is difficult, right? I mean, there's a lot we have to juggle, and unfortunately, we don't get all the resources to do that. So I will say, when we're building out a program, it's kind of like, how do you eat an elephant? It's one bite at a time. Right? That's the key with it is, don't get overwhelmed with putting in, the great controls that you see through all the advertising. Don't look for that magic bullet because it doesn't occur. And a lot of times there's probably pretty simple controls that you already have in place that we can tweak and tune and get ready. And I think that's a good place to start. So what I highlighted, what I like to see is 3 core pieces for a good cybersecurity program or risk management program. The first is, we have to adopt a framework. I think that just helps to level set, get everyone talking on the same page. And from there, we can drive to the next thing. But that gives us here's our basic set of controls, here's the framework we're going to use, and we can start to test at that point. The next piece is the risk assessment. We have to be able to take that framework, know what the controls are, and start to assess where do we sit with it, and kind of go all back to that risk management process I mentioned before. Going through there, and now we're starting to see what those risks are, what the gaps are within our controls, and how do we fix it from there. And this third piece it's a little bit more complicated, a little political a lot of times, but it is something that is critical to any security risk management program, and that is the executive management involvement. I think where we get the most success from, how we can be the best us possible, is if we have actual leaders within the organization on our risk management team, whether that's enterprise or just specific to cybersecurity. Where I've been, like I mentioned before, where I was embedded within enterprise risk, I've had clients who, sometimes we have an IT steering committee that was formed with, members on that are the CEO, CFO, legal is represented, compliance, they're part of that. So I would say, right then, take over 10 minutes of that meeting if possible and share what the risks are within cybersecurity. And then from there, grow it from there. So those are 3 core components I would like to see. I think that we need to focus on. And then the other piece is making sure we're just driving through good cyber hygiene, looking at what controls exist out there. A lot of times, the technology that we're purchasing it overlaps, right? There are multiple things we can do with one piece of technology. The new antivirus controls today, they have a whole host of other things that they can do. So using each of those tools to their maximum potential, making sure that we're most effective and efficient with what we have. And that's where we go from there. The other piece of this is every organization is different, right? I think if you've seen one healthcare organization, you've seen one healthcare organization. We all have unique set of circumstances. We're all a little bit different. So start here. This will kind of lay that foundation, and then you can decide what's the right path from there, and then build out 1, 3, 5, 10-year roadmaps so we can get to the most mature as possible. And then the last piece I have on here, I think this is really interesting to see. I'm a very I have to see graphics and images. Slight ADD and dyslexia for me, that I like colors, I like seeing stuff like this. So a lot of times what we'll do, I'll go through our security tool. When we do a security assessment, we'll go through all of the controls that we have. This is just an example of some of the controls that we look for as we do our assessment. We'll go through there and really, based on maturity, understand how good that particular control is for the organization. Right? And we got a method to that madness as we go through it. But, kind of go through there. And it really helps to highlight where do we need to focus some of our attention on. Now, this is a little bit different from the risk management, but this should be a direct correlation to risk, right? We should be able to see if we've done our security assessments and we have gaps, that they're showing up in here as well. And so I like to incorporate this into our roadmap. A lot of times what we'll do is, when we do our assessment, that will be some of the core pieces of the plan going forward, build that into the 1, 3, 5 year roadmap. We'll take this slice and view of that information as well, build that into the roadmap. That way we kind of get, like I said, different views and different ways to communicate that up to leadership. Once again, this is also a really good image to include in a presentation that you're giving to the leadership team, because if you're all red, it really grabs people's attention. So, piece there as well.
Hey, John.
Yeah.
I'm sorry, Cheryl. Go ahead. I didn't mean to interrupt you.
No, we both, I think, started at the same time. I was going to say apologies as well. How often do you recommend that the organization sort of relook at this? Because obviously, if you have things that are needs improvement, they may have a higher priority versus some of the others that are green. How often do you feel that they need to review that, refresh it, make sure they're on track, and that they're moving those things from, yellow or red to green, or in process?
Yeah, so what I would do, there's a couple of different ways to look at that. I think one, use this as almost an operational tool, where as we're implementing new controls or we're updating and managing new processes and making things better within our small team, that we update it then. So it's kind of a living document with that aspect. But I would share it with leadership. I did it quarterly. It's part of my quarterly report. Sometimes if there were no problems with it and we had, little progress according to our roadmap, we didn't really spend much time on it. But if we were having, big obstacles with certain things, then I would call that out. I'd say, we're still red over here for detection processes because we had to cut funding within the department by 10% to meet, plan. And this was one of the items that came off the list. So that's why that's red. And that way, it's just everyone's aware, everyone's accountable to it. And then same thing with the good, right? I mean, a lot of times what we would find is we were planning on purchasing a piece of software or updating a process, and we thought we were only going to get, one piece of that, but we ended up closing out 2 or 3 issues, and really on this one, flipping 2 or 3 issues green. So we would make sure to kind of give that, kudos to the team that we were able to improve in these areas because of what you let us do last quarter. So, I would you got to play it by ear a little bit, but I would make sure that it's communicated regularly. Quarterly seems to be pretty good, but I would, personally, use this as an operational tool that we're always, updating and going forward with.
John, is this heat map and the columns that you have and the individual components of those, is that, collectively exhaustive? I mean, are we going to find other boxes that we have to add into this that we didn't know existed before? Or do these represent, a full framework that if you're in an organization as a CISO, you can work through a framework like this, a map like this, and know that you're not missing something? If you were to look at this today, would you say we should probably add a couple of boxes under a couple of columns, or this is up to date, this is current, this is something that anyone can use?
I would say as of today, this is current and up to date, something everyone can use. What I've seen with the amount of technology as it changes and different things that we see going on, we probably need to go through and refresh it often, maybe once again, kind of on that annual approach, something along those lines, unless we know something big changes in the environment or just within the industry. But for the most part, I would say this is solid to use and work from at this point.
Thank you.
Yep. And then we're back to the asset control list, kind of another example or the example before of some of the assets, how we track them.
Is there anything? Oh, sorry. Go ahead.
Oh no, I'm sorry. Go on.
I was just going to say, for some folks that are maybe not security focused in their roles, do you want to just explain kind of what you expect to see in the columns and maybe what DLP means and SIEM, just so they understand what that takeaway list can be used, or they can pass it on or whatever?
Yep, absolutely. So this is, this piece here is not an exhaustive list of controls. This would fit on my screen and still be legible. So we can always continue to add on critical controls, things that we see. But to me, so the way this is set up and the way this works is really that whole KISS principle, right? Keep it simple. and what we do is go through, this list and kind of put the yes, no. If we see, if we know that piece of equipment or application does store, access, transmit PHI or confidential data, the other things you want to track. And that's a good indicator of, crown jewel, something we need to focus on. On this particular list, we put 500 plus because that was one of the things that the client was interested in, is they wanted to know, if it's less than 500, it's important, but that's not going to be our primary focus. That's kind of the 1A, 1B principle. But then, we'd also start marking, was there a prior assessment? And if so, when? So on this, we'd put a date with that. The primary access control, this is looking, is it Active Directory or is it within that system? And if you're not familiar with kind of Active Directory, is the main thing that we key in our username and password in the morning when you're starting up your device. Multi-factor authentication, MFA. So that's where, if you're using banking, it happens a lot of times. Healthcare, we're getting better at it. But that's where, you enter in your password and then you have to put in the code either from your email or smartphone. You get a phone call that says you have to hit yes to allow access. So that's what we're looking for. And if it's internal, so if I'm on the network, I'm within the four walls of the organization, do I have to do that? Or external, if it's coming in, if I'm working remote and accessing it, we have that multi-factor there. And that's just a good yes, no kind of checkbox in there. DLP is data loss protection. And that's one of those security controls that you can look to see if we define what we want our systems to look for. So if it's PHI, we're looking for the member number, or we're looking for social security number. We're looking for a diagnosis code or medical record number. And the system, the DLP system, will identify that as it's moving from one source to the other. So kind of through email, it'll see that and it'll flag it, and then we can have that control decide what to do. Do we quarantine it and have the supervisor, authorize the release of it? Do we just encrypt it and let it go? You can put those rules around it's smart technology to look at that information. A SIM is a security incident and event management tool. And what that's doing is, think of kind of log correlation. So all of the systems that we have within our environment, both security and IT, they have a lot of logs. They're logging a lot of information of the activity that occurs. All of that's fed into this SIM monitoring tool, and it's correlating that with threat data or other data sources to look for. I have a particular user who is logged in from Idaho at one time, but then all of a sudden within 10 seconds now they're logging in from Sri Lanka, right? And that's not going to be easy to do. Most likely somebody did not make that transition that quick, so that flagging that as a problem. That type of activity is an issue. And this is another one, internet facing, very simple, right? Am I able to access this particular application from the internet? Is it remote access? Can we get into it remotely? And then does it have backup disaster recovery plans and processes?
John,
so this is just kind of, yep.
Just a quick question from our colleague Janice Karen, who asks, and it may fit into this asset and control grid that you've laid out here, but can you address the difference between in-house IT, cloud, and hybrid models in terms of this risk assessment process that you're describing for us?
Absolutely. So I'm a firm believer that we have, for that, three different components, three different assessments that we look at. Might come from the same framework and start with the same set of questions, but then we change the scope of them or filter a few out just based on the source, whether is it in-house, is it a cloud, is it a hybrid. So everywhere I've worked, we have those three different assessments. And when it comes to in-house, I'm not really too concerned about how they're managing human resources in-house. I know that. I'm not overly concerned with the firewall security because I already know that's in place. So I kind of cut out some of those the higher level controls, and I'm focused really more on how that piece is being implemented, what's available within the application or the system. So that's kind of specific to that. Now, I said all that, but I still do the enterprise assessment to know all of the controls that exist in my environment. So kind of if it's a new in-house application, I have a limited scope, but I still do my enterprise assessment. From a cloud, I like to call the cloud and hybrid. I'll put those under a vendor management role. And so what we do is we are going to do a deep dive for each of the vendors that we have, we're going to, sort of tier that vendor, right? To kind of understand, are they going to be storing patient information? If so, how much? What's the frequency? And look at some of that information, very high level, maybe 5 to 10 questions, to put them in a tier, 1, 2, 3 of importance or priority. And then we're also going to look at, so we would kind of do that to understand, and from there we're going to do our security assessment of them, looking at them top to bottom. And honestly, what I'll look at is if it's going to be say we're signing a 5-year contract with a vendor that's going to store all of our millions of patient records, I want to look back at that vendor annually and make sure that they have not changed their processes. And if they have, make sure that they're still secure, right? I want them to attest to that on an annual basis. So I'll bake that into the contract, do the vendor assessment, and give them know the impact of their organization to us, and keep that in my system. Now, sometimes with vendors, there are things that we have to work on and improve, and we'll put that's part of that decision-making process I mentioned before within the group, and we'll understand, do we need to hold off on signing the contract until a new control is put in place? Do we sign the contract, but just say that, they're kind of in a probationary period for the next 90 days until that control is implemented? And does that give us that sort of, out of the contract if needed? Now, realistically, a lot of times within the organization, if we're signing a contract with a third party to perform this for us, some of the security controls really aren't going to be the highest priority to that relationship, right? So we just need to make sure that we are constantly working with the vendor that they're improving their security program. Where I've seen it, that really come into play and be really helpful for the group is when I was with a smaller hospital, we had a lot of startup companies that were trying to sell into us. We were a research academic medical center, and they were wanting to sell a lot of startup companies, great ideas, but they weren't fully baked yet. Like they just weren't quite there yet. Whether they're still working out of somebody's basement or garage, nothing wrong with that, but it just wasn't quite there for enterprise readiness yet. So we'd go through the assessment, we'd present that information, and a lot of times what we were able to do is say, we're not willing to sign a contract yet. We don't want to send you our data yet, but if you can do and implement these controls and provide evidence of that to us, we will be willing to sign a contract in 3 months or 6 months. So it was kind of ended up being a good thing for us, because the vendor was then fast tracking putting in those controls, going through some type of attestation to validate that they were there, and then we could sign a contract and have confidence that we're doing the right thing with the patient data at that point. So that was answer that question. Yep.
No, that was very helpful.
And I will say one other thing that I've made sure that we put in every vendor contract when I was on the provider side is we would make sure that every one of our vendors had and would attest to a set of, it was about 8 to 10, 8 to 11 security controls. So I wanted to know, I wasn't very prescriptive with it, but I wanted them to sign that they were encrypting the data in transit, that they had physical security controls for their data centers, that they were using antivirus protection. Once again, I wasn't being prescriptive, but I just wanted to make sure that they had those core pieces in place. So should something occur down the road, we could say they've attested to this.
Thank you. That was a great answer.
Yep.
We appreciate it.
Absolutely. All right. So I've covered pretty much all the content that I have. So I'll open it up for if there are additional questions. Love to have any additional dialogue or get into any specifics.
I have one question for John or for Cheryl. You're going to be joining an even bigger organization in the months to come, whenever that comes to fruition with Optum. And Optum offers, a suite of services themselves for just this kind of thing. What do you see being the strengths that you're going to, what are some of the things that you're going to be able to do with Optum or, with a partner that you can't do now, or that you can do better than you can do now? Are there particular things that you see in the security arena that stand out?
You want me to take that, John?
I'll let you run with that one.
All right. So yes, there was obviously the announcement that there's the intent to merge with Optum Insight, Optum in general, but Optum Insight as the subsidiary. Really, all we're able to say is that yes, it's been announced. It's subject to all of the regulatory reviews and stakeholder reviews. And really, until that point, we are totally separate, business as usual. There's no conversations between the organizations, and we really wouldn't be able to have any comment about anything like that until after the deal closes, and then there'll be integration discussions that will begin at that point. We're very excited about the opportunities, but today it's business as usual. We're two separate entities, and we are still operating in that forum. So I guess stay tuned, maybe invite us back at the end of the year.
Yeah, more to come.
We'll definitely do that. We have a couple of questions coming across the line here, one from Janice Karen and one from John Vergona. A lot of what you describe is pretty process intensive, and even for a moderately sized organization, they may not even have the roles that you reference. Are there 3 to 4 key elements that you would recommend even for very small organizations? MHTC, we're going through a security audit and review and the like at this point in time, and it's an arduous process. And for small organizations, do you have like 3 to 4 elements that you would say, don't miss these? If you can only do 3 or 4 things, make sure you do the following.
Yes, let me go back to the process document slide real quick. Just I think I am. There we go. So yes, and I will say, when I was with Catholic Health Initiatives, I was on the governance and risk team. I was the director of governance and risk. I had 23 employees, and we completed 250, 280 security assessments a year. And then I went to University of Louisville Hospital and Medical Center, and I had a team of 2. I was one of them, and we did about 50 security assessments a year. And so, I think, to your point, there's definitely has to be a balance, right? It's all about sort of scale. This can be an arduous process if you let it. But I think the key is, one, the threat data, we have to collect that. The assets, we need to know where the assets are, so we're focused on the crown jewels. And that's going to be those that are the most important to us, those that contain PHI, could be internet facing, have remote access, things like that. We'll flag those. And this is kind of, I'll say, this is ongoing, right? We're getting feeds in all the time, and it just almost becomes routine. Not a lot of time spent there. The modeling aspect of it takes a little bit longer, but that can sort of be just a routine exercise as well. Doesn't have to be overly time consuming. The asset data is difficult to get off the ground, but you can bake it into certain routines once you get it kind of going. Minimal time spent there, right? It's just really, we're just documenting that, kind of doing a routine check here and there. The control, so this is the traditional security assessment where we're going out and asking questions. This can be a little bit, and I typically would dedicate, when we did our annual security assessment at the hospital, I would dedicate about 2 weeks for that. It was one member of our team, conducting that assessment, having interviews and questions. But it was just, we would plan that in as part of the annual work that we did, and then with each new vendor, it was part of the project. That was a piece when we would do our vendor assessments. We didn't do the initial assessment. The security team was completely out of that, and it was part of the project itself that we would send over our questionnaire, and then we would review it, and we were just looking for what are the inconsistencies, what's out of, sort of above the line issue that we were concerned about. And so we were able to kind of cut that down quite a bit. When I was with the larger organization, we would actually write a formal report for each one of those. When I went to the smaller, we didn't write that. We didn't go into a lot of wording about it. We just didn't see the need for us to document a lot of words. We would really just go through, we documented what issues we found and why they were an issue, and then we would communicate that to the project team. Sometimes that would be taking the leadership to make a decision, sort of part of that no. but we were able to streamline that. That would only really take us of actual work a few days. Typically, it was chasing down the assessment. The project team would chase that down, getting the vendor to complete it. But for our perspective, we did an analysis. We just kind of reviewed it and then would send it off maybe a day or two at most. And then this impact analysis, this was one that was just part of our disaster recovery business continuity. We would have a security team member. One organization, we were part of that. We conducted that. The other one, we were just a team member on it, and we would just kind of help to pull that information out. So that was on both of those, pretty minimal work there after the first one. The first one was pretty heavy, heavy lift. After that, it was pretty light on just updating and making sure we're in place. This analysis, I will say, I mentioned kind of the three different levels, right? You have the qualitative, the semi-quantitative, and the quantitative. This can be very resource intensive if you're doing it by hand. There are a handful of platforms. One of them is from HealthGuard here, which I worked with to build this, that they build the scenario and the Monte Carlo simulation into their platform. RiskLens is another one. I know HITRUST is partnering, I think, with RiskLens and RSAM to build that in. So those are, some of the tools you can use to help make that process a little easier. And I would recommend that. But overall, I would say one person should be accountable for making sure, the key components of this are followed, the assessment and the analysis, and then sort of the project management component of it from there. And that's where I would focus and spend a lot of time. But it fluctuates, right? There's times where you're not, there's some, slow time when it comes to the assessment. So we are focused on the treatment and the monitoring, and it kind of, it'll move around, but there probably should be, at least one person accountable for that component. And then, as always, I'll give the plug here that that's what we're here for from Change Healthcare. We'll be happy to help, with your organization on really finding that priority and standing some of that up.
That's kind of where I was going to say, John. I think it depends on the organization and how many folks you have sort of in that role and what you can do internally. It may be the initial lift, maybe you need some help. And then after that, you're able to maintain with the staff that you have. Because I don't think you can skip any one of the steps per se. It's not like you can cut out, sorry, I'm trying to read this, like, under the treatment, under risk treatment or monitoring, you can't necessarily cut out a phase and you can't necessarily cut out a step, but you can decide how deep you want to go. And if you've never done one, maybe you get help in a couple areas. And then once you've got that framework set, then you're able to maintain going forward. So I know that it's probably a little bit of a specific answer depending on how you're structured, how many people you have, even also what skill sets you have in-house. There may be certain skill sets that you don't have in-house that you can augment. And I had some responsibilities for security many years ago, not at the level of detail that John did. I was just responsible at the higher level. And we really had to take a look at that and say, what do we have in-house? What don't we have? Where do we think we're vulnerable? And then we come up with a plan of how we want to solve for that. So, it may be, you may have some sensitive things you don't want to ask in more detail here, and we can certainly take that offline.
Okay, we have a question from Nicole Malone, who says, in a scenario where you identify a large risk that will be costly to mitigate, and the source of that risk, is a department that may not understand the security risk and why they should prioritize it in their budget compared to other priorities that they have. What do you suggest to an organization? What would you recommend they have in place in terms of governance and a plan of attack to be sure that the action plan is actually carried out? If you're in an academic medical center, John, as you can appreciate, clinical departments are tubs on their own bottoms. They have their own worlds, and you can get all the way to the department to have changes made in their systems, but it can be very difficult to actually get it done. Can you talk a little bit about how do you make sure that action plan is carried out in places where it's more difficult to do than others?
Yeah, so I think that is definitely the first piece of that is making sure that you have supportive leadership when it comes to risk management. right? Fighting through that or kind of getting that squared away is key. And making sure that when we have the risk committee or an IT security steering committee or IT committee, that we have leadership involved in that as well. That way, the kind of over on this this action plan piece and the monitoring, that you're able to provide those updates to the leadership team. So it's not just coming from you in that siloed department, but it's coming as this is our organizational priority. This is what we see needs to occur within our company, and it's coming from a leadership down. The other piece to that, and this is, so that's extremely important. That's where you'll get a lot of work done. The other way to kind of, maybe backdoor some of that in is also when I was in the hospital and I would do rounding. So I would go and every month somebody from my team had to go out onto the floor, we'd pick a department and we'd do rounds. And we knew where we're going to have, some of the key issues, or we have the most action plans, locked up. We would go out to that floor, and we weren't doing an audit. We weren't there to, upset anybody. A lot of times I would bring coffee and donuts in because I knew what I liked. So, I kind of, we're there to butter people up and build a relationship and just have good conversations. And once we started doing that and started, really just talking to each other as people and not, you're from security or you're from audit, we moved things, it moved so much, better. And it did it from a couple ways. One, I really understood why that was an issue, moving that forward. Was it truly budgetary? Was it we just don't want to do it? We've always done it this way and we don't want to make a change. And we could kind of have less tense conversations and share ideas and information. And maybe the action plan that was originally, created just didn't fit. So we would tweak it and we'd go, make some adjustments and come up with a really good compromise that we could all live with. So I'd say it's kind of the two pieces to it, is make sure leadership's involved and buy coffee and donuts for people.
I think a lot of coffee and donuts makes good sense. We have one other question here from John Vergona, who asks, a lot of healthcare organizations are focused on PHI. They're focused on the electronic medical record. But I'm sure you come into organizations where there are risks elsewhere, and they need to have an approach that is hybrid. Could you talk a little bit about how you address the rest, quote unquote, the rest of the organization, apart from, the clinical crown jewels? There's a lot of information in other systems that can be costly and risky to lose.
Absolutely.
Or have corruption.
There's two things. There's a couple things with that one. One, PHI is always sort of the easy sell because of HIPAA, right? We have the regulation that backs it. That tends to be within healthcare, so that's the big stick that helps us move that forward. So you're right, that does get all the attention, it seems. But I will say, when you do the analysis and we determine what's the impact should something occur with that data, that's what helps to drive. So, when you look at sort of a loss event, you had your primary loss event, lost the laptop, that's a physical asset that has a cost to it. But the secondary loss is going to be the things like we're reporting this to all of the patients, or reporting the lost Social Security number to other folks, or whatever that IP is. That has a cost to it as well. So we need to determine what's the impact of that. Along with, what's the impact if it's the fines associated to it, if that should be, the lost revenue tied to that. So those are the other things that I think go into that impact to really equalize all of the information. So it's not just a PHI always wins, but it's really, at the end of the day, we care about the patient safety, we care about the financials. So if we put things in those terms, that kind of just, it really puts that the standard across the board that we can all live with at that point. And then it doesn't matter the data type. We're looking at the impact of it.
Thank you.
I would add, oh, sorry, Denny. I was just going to add
go
to
ahead.
that. In organizations I've been at, it is more than the PHI, right? So in Massachusetts, we have PII regulations, which isn't necessarily PHI, and I've had discussions with people elsewhere that aren't as familiar. And so having to make sure we're complying with that. And we also took a holistic view, right? There's some customer data that's unique and special, and you don't want someone getting into those systems. Your financials, i.e. outside of billing and claims, accounts payable, accounts receivable, there's so many things that have been moved to the cloud as well. So you're right, it's more than just the clinical slash claims processing exercise, there is more to it. I think people can tend to start with the PHI, as John said, because of HIPAA. But in terms of loss and business reputation, there's other systems that you have to consider as well.
Right.
So
That's very helpful. We're running, I think, we're close to quarter to the hour. We've had some people sign off, but we've had a lot of excellent conversation, and we want to be sure we capture people's questions. So for those of you who are still online, please type in your question or unmute your microphone and ask Cheryl and John any other questions that you might have. This is where I silently count back from 8 or some predetermined number to make sure I'm giving folks appropriate amount of time. All right, this was I think this framework, the process that you put forward.
I'll unmute. You didn't count long enough.
No, I saw you pop up. What do you do when you don't have supportive people at the top? I mean, what happens then if someone wants to bring you in and you don't have supportive people at the top?
John, can I start on this one? And I'm saying this
run with it. Yep.
I'm saying this tongue in cheek. I usually ask them if they look good in stripes. Because if something falls and they're at the top, where are the regulators going to come talk? That's the group that they're going to come have the conversation with. So I do say that tongue in cheek, but I'll let John give the answer.
Before you let him answer, I would point out that as an outside person coming into process, you probably have more ability to say that than an employee who's trying to do this job.
I would agree, but I will say we also kind of did it tongue in cheek when I was employed at the organization as well, because we were really trying to get that point across, where maybe the person was financially focused and didn't quite understand why they should have to pay for something, right? So you kind of have to go back to the regulations, and there is an education piece that needs to happen too. HIPAA at the time, back many years ago, it was HIPAA Security 101, HIPAA privacy. Why is it important? So sometimes you've got to start at an education step. And then John, you may have some ideas as you get into more of the technical pieces, but I understand, Janice, every organization's got kind of a different culture, and you've got to figure out where and how. It's almost like you have to outmaneuver them to get them to understand.
By the way, I'm not commenting on my current organization when I ask that question.
And I don't even know where you're at. So that's all good. All good.
Yeah, and so I'll add on, because my joke has always been I don't look good in orange, the orange jumpsuit. That was always kind of what I would go with. But everywhere I've been, there's been a different level of issue with that, right? It ends up every company has its own set of cultures, its own politics. So you have to just sort of navigate that to a certain degree. I think the big thing that I've always done is I want to be as factual as possible and provide the context that's necessary to make a good decision. Here's all the data points. I never wanted myself to be in a position where I am making that decision on my own, right? It has to be a team effort when it gets to this stuff. Third, and this was the one that I had a couple leaders who were very resistant to implement some controls because of the expense. They could see the impact, they just didn't believe it. They didn't feel that was an accurate portrayal of the impact. So what we did is we said, okay, then 100% part of our process is if we don't want to treat, mitigate or transfer that, we're going to accept it. So as part of our risk acceptance process, we had that up form that they had to fill out. We typed that up. Here's the issue. Here's the scenario, the context behind it that supports it. Here's the impact. And then this person, all risk is assigned to an individual, each risk item was assigned to an accountable person. They were accepting the risk on behalf of the organization, and they had to physically sign their name. And I tell you what, when it was as a group or committee, we can just accept it and things were, good to go and no one cared because it was a committee doing it. Things slid by quite a bit. But when we made the decision to put somebody's name on paper and they had to take a pen and sign it, wow, that no one wanted to have their name on that. And it quickly became, well, let's say we can fit that into the plan. the key piece to that is it's not necessarily we need this fixed by tomorrow, but it's our plan is, oh, you know, here's our project plan, and we're starting in March, and we're going to plan on wrapping this up in July. You know, when you have that kind of time, because we're realistic about our plans. We didn't want them to be, you know, pie in the sky. We're going to implement, you know, all these massive controls tomorrow. We knew better than that, but we had a realistic plan. We to march to it, tick away. It's part of funding and resources. So our plans, I mean, legitimately, we would have plans that lasted for 2 years, just because that was where they fit within the organization. But when they decided that they didn't want to take it on and they wanted to sign their name to it, before that pen would touch the paper, they did a lot of thinking. There was some soul searching going on because they knew this is theirs now. They own it, and should something occur, it's their name tied to that.
Mhm.
So,
Well,
but once again, you got to kind of finesse that in, right? There's a balance with how you push that through. It's not a slam it in. You got to do some finessing, talking.
you got to finesse it. Right, I can see that. I think we're running close to time. We're starting to have people sign off. I know we'll ask one more time, and I will count back from 8 silently. If folks have any questions of our webinar panelists, Cheryl and John, speak now or over the next 8 seconds.
John, why don't you move? Oh, sorry, Denny. John,
No,
why don't you move down to the contacts slide?
Oh, yeah.
And we'll be ready to close out here.
Good.
And while you're waiting to see if people have other questions, I did want to say there's a couple of things as we talked through today. John and I are going to go through, we'll just tweak and insert a couple of more comments on these slides and get it back to Arlene so they can go out to you. I think in a couple areas, John had some suggestions, just example vendors and things like that, that sometimes I think don't come across well in a recording if someone's trying to write it down and you're not sure how to spell it. So we'll tweak a couple of these slides and get it back to Arlene to distribute.
Great, and we'll put those on our website.
Right.
Along this will be including the pages as well as a recording of the presentation. So those of you online, you can expect us to turn that around as soon as we get from Cheryl and John the revisions and updates. It takes us just about 48 hours to turn that around. And if you don't have access to MHDC's system, or you simply log into mahealthdata.org, and you should see these pages available. If you'd like to register so that you get that information sent to you automatically and learn more about MHDC, please contact Arlene Coletti, a.coletti@mahealthdata.org. And we'll get you on the system so that you can see and be apprised of other events coming up. So with that, Cheryl and John, I really want to thank you too, and for your presentation, for your ongoing support as an executive member of our consortium, which is marvelous. We think that's great. We want to thank everyone who attended and wish you all well, and that you all stay well and safe. And with that, we'll adjourn. Thank you very much.
Thank you.
Thank you.
Thanks.
Have a great day.
Thank you.